Come in.
Hello, Sherry.
Hi.
I am Kendall Ray. I'm going to be your occupational therapy student today. How are you?
I'm good. How are you?
I'm pretty good. All right. To get started, can you give me your full name and date of birth?
Sherry Habib, 4/22/66.
Perfect. Okay. So, Sherry, what brings you in today?
I'm still having a little bit of pain and trouble with my wrist. It's hard to bend it forwards and backwards, so it's kind of hard to do things that I normally do.
Okay. So, what happened? How did you end up with a hurt wrist?
I was at my friend's party and I was going to leave and I was walking down the steps and my feet went out from under me and I fell backwards and tried to catch myself and broke my wrist.
Okay. So, did you break your right or left wrist?
I broke my right wrist.
All right. Is that your dominant hand?
Mm-hmm.
Oh, of course.
Yeah.
Okay, so you said that it's affecting some things that you do. What are those things that you're having trouble with?
Well, I'm a yoga instructor, so I haven't been able to teach my classes. It's difficult to get dressed in the morning, and I'm also a scrapbooker, so
Okay.
I use scissors a lot, and it's been really hard to hold the scissors.
Okay, so are you experiencing pain when this is happening? Is there any swelling?
Yes.
Okay, so on the pain part, what is, like, on a scale from 1 to 10, would you say your pain on average is?
Probably about a 3.
Okay, that's pretty low. That's good. So we're going to try to get that down a little bit lower. So, Sherry, whenever you hurt your wrist, did you have any surgeries or what happened with that?
I did have a surgery about 3 weeks ago.
Okay, so did they go in and put some plates in?
Mm-hmm.
Okay, so with those plates, we're just going to be sure that your incision is clean and clear. Can I go ahead and look at your wrist?
Mm-hmm.
Okay. All right, good. There's no swelling. Your incision sites look good. All right, so with that being said, we're going to go ahead and go on with the sensory assessment that we're going to do today to see if you can tell the difference between hot and cold. Okay, Sherry, for this assessment, we are going to test the difference between hot and cold within your hands. And I'm going to see if you can identify it. So the hot one is set to 110 degrees and the cold one is about 40 degrees. So we are going to do that with both your left and your right hand. So first, I'm going to have you put your left hand up here. Wipe these off. Okay. So I want you to keep your eyes open and tell me the difference of the hot and the cold, okay?
Cold. Hot.
Okay, perfect. Can you flip your hand over?
Cold. Hot.
Okay, let's do your right hand.
Hot. Cold.
Okay, flip it over for me.
Hot. Cold.
Okay, perfect. So you were able to identify those. So now I'm going to have you close your eyes and I'm going to use different ones on each hand. And I want you to tell me the difference, okay? Whenever you know which one's hot and cold, just say what they are. Okay, left hand first. Thank you. All right, close your eyes.
Cold. Hot. Cold. Hot. Hot.
Okay, flip your hand over. Thank you.
Hot. Cold. Cold. Hot. Hot.
Okay, perfect. Now let's do your right hand.
Cold. Hot. Cold. Cold. Hot.
Okay, flip your hand over.
Hot. Cold. Hot. Hot. Cold.
All right, perfect. You can go ahead and open up your eyes. All right, so you scored perfect on that, which is great, meaning we can go ahead with the paraffin bath because it is warm. And so meaning the results from this test, you have no decreased sensation within your left and right hand. Okay, Sherry, to get started, I'm going to look at your wrist just one more time to be sure that there's no open wounds, there's no edema, and also that there's no bruising. Can I go ahead and do that?
Mm-hmm.
Perfect. All right, the skin is clear from bruising, open wounds, or edema. I do know that you had a plate that was put in your arm whenever you had surgery. We are going to use that as a precaution, and we're just going to keep it within our hand. So that's going to be one precaution that we use when we use the paraffin, okay? So the paraffin essentially is warm wax that we're going to place our hand in. It's going to really open up those blood vessels and allow for some movement. It also is going to allow the muscles to relax so there's not as much stiffness within your wrist whenever we're doing our exercises today. All right, I'm going to go ahead and check the wax to be sure that it's to 125 degrees. All right, perfect. It is to 125 degrees. So you've already washed your hands, correct?
Yes.
Perfect. So we are going to spray this cleansing treatment on it as well. You can go ahead and rub that in like hand sanitizer. Okay, great. Now that your hands are fully clean, I'm going to tell you how to use the paraffin. So whenever we go, I'm going to direct your wrist and hand into the paraffin bath, and I want you to keep a relaxed wrist and fingers, but I want you to keep your fingers spread apart. We're going to slowly dunk your hand into the paraffin, and we're also not going to touch the sides or the bottom because that is the hottest part. So whenever we go, I want you to keep your hand in the first position that we start in because it will break that heat seal if not, okay? All right, so we're gonna go ahead and get started. Can I have your right hand? Perfect. Keep a relaxed wrist. Are you ready?
Mm-hmm.
Okay. Up. 1, 2, 3, 4, 5, 6, 7, 8, 9, one more, 10. Perfect. I want you to stay right there. We're going to place it in this bag. Leave your hand just as firm as possible. Perfect. And now I'm going to wrap this towel. Oops, excuse me. I'm going to wrap this towel around your hand to ensure that heat stays within, okay?
Okay.
All right, now that it's wrapped, we're going to go ahead and go sit down.
Okay.
Okay, Sherry. Now that we've sat back down, are you comfortable?
Mm-hmm.
Perfect. Okay, we do have our wrist and hand elevated so it can increase that blood flow back to our heart so there's no increase in swelling or edema within our hand. So if you experience anything that's uncomfortable within the next 15 minutes, please let me know immediately.
Okay.
Okay, Sherry, now that our 15 minutes is complete, we're going to go ahead and take that paraffin off. We're going to take the towel off. The residue that the paraffin leaves on your skin is kind of like lotion. I want you to really work that into your hands. You can even rub your scar with it. And then I'm going to assess your skin to be sure that everything's okay. All right, I'm going to gently pull on the paraffin while it's still in the sack. Perfect. All right, there is some redness, but that is to be expected whenever we use the paraffin, but there doesn't look like there's anything that's increasingly alarming. So you can go ahead and massage your hands with that. And then we're going to continue our activities for the day. Okay, Sherry, now that we're done with our treatment session for the day, I'm gonna send you home with this splint that I've made for you. It's called a wrist cock-up splint. It's to a 30-degree angle so that it allows proper blood flow throughout your wrist and hand. So whenever you sleep, do you feel like you sleep with your hands like in funky positions or?
All the time.
Okay, so yeah, I sleep with my hands like this, so I understand. So we're going to send you home with this, and I want you to only use it whenever you go to sleep. So we're going to put this on before bed, then when you wake up in the morning, take it off and go about your regular day. Okay, so I'm going to show you how to use it first. Can you give me your wrist? Perfect. We're going to slide our thumb through there. Okay, perfect. So these straps just go to the Velcro on the opposite side. Not too tight, but not too loose. Okay, I want you to move around just a little bit and feel if you feel anything pinching or hurting you. Okay, that's great. That's what I want to hear. So if you feel anything hurting on you, like if you see any red marks in the mornings whenever you wake up, if in the middle of the night you're like, oh my goodness, that's hurt so bad, I want you to go ahead and take it off and then come back to me so we can go ahead and make those adjustments to it, okay? So some things to think about whenever you go home. Please do not leave this in your car if it's hot at all. And I don't also want you to put it around like a stove or an oven because it will remold this and change the shape of it. Another thing is whenever you need to take care of it, you can just use some soap and water to wash it off whenever you get home. That is really all about it. Is there any other questions you have for me?
Yeah, I don't think so.
All right. Have a good day.
Thank you. You too.